got diagnosed, I used to be very thin talaga. Thin, with regular menstruation, but late 2015, sometime around December or November, I was diagnosed with PCOS. That time, ang PCOS, hindi pa siya basically well-explained. Dito na si PCOS nag-strike sa health ko. Nung nag-start akong mag-breastfeed, tapos in-stop ko na lahat. As in, kasi syempre, when you're breastfeeding, hindi ka pwedeng mag-diet. Kaya din siguro, I started having hypoglycemia, especially ng afternoon. Tapos, yung weight ko, as in, ang laki ko, I started gaining weight. Super drastic yung pag-change ng weight ko from size 2 to size 8. As in, ang laki. Tapos, ang baba na ng confidence ko. Sabi na ng mga brother ko, mukha na daw akong aparador, mukha na daw akong gasol. Aside from the hypoglycemia, drastic weight gain, meron pa akong migraine, chronic migraine. Mainit, malamig, whenever I'm stressed, ang sakit. So, parang binabasag talaga siya. Nahihilo na ako talaga, nagsushoot up yung blood pressure ko. Kahit walang trigger.
How did you come across Simply Nature PPARS?
Nalaman ko siya through Ma'am Jansen and Sir Shyan. So, they introduced PPAR to me kasi one time we were having lunch. So, very big yung appetite ko. Akong excuse si Ma'am, always tired meal. Ako, he looks 30s, 20-something, mga ganon. So, sabi ko, gusto ko ako din. Kailangan, paglaki ng anak ko, mukha lang kaming friends. When I started using PPARS, first month pa lang. Actually, first week pa lang, I started texting them na, Sir Shyan, Ma'am Jocelyn, I don't have episodes of migraine at all. Kasi yun talagang kita ko. Kasi everyday, nafe-feel mo eh. Wala, even if it's cold, it's hot. Yes, kasi sabi nila, ang hirap daw, sabi ng doctors, once you got diagnosed with DM2 or diabetes, it's really hard na i-reverse.
Exactly. How did your doctors react?
They were amazed yung OB ko. First time, kasi OB ko na sila before pa eh. So, first time, since 2015, kahit ako, first time naming makakita ng clear, normal.
Guys, just to let you know, as you can see on your screen, the result actually says ovarian is bilateral. So, both sides.
Yes, bilateral. More than 20. Tapos may specific size pa siya. I can share naman yung lab result. Tapos ngayon, left is already clear and normal. Tapos yung right ko, reduce na yung size. So, working on it para ma-clear na siya. So, first of all, I wanna thank Sir Shyan and Ma'am Jocelyn. Really, as in, sobrang thankful ako sa kanila. I thank God for their lives. I have nothing but gratitude for them. Having this product improve my way of life talaga, as in. Tapos more pa para yung ibang friends ko, actually nakikita na rin nila eh. Encourage ko na rin sila, medyo nire-refer ko na rin sila. Tapos kaya mo rin to.
Exactly. And just like how Sir Shyan and Ma'am Jocelyn did it to you, it wouldn't be hard anymore because they see the improvement, they see the result on you as well.
Living witness na sila eh kung ano yung nangyaring changes. Good morning, I am Monique B. Marzan, 31 years old. I'm currently working as a property manager here in BGC. I was diagnosed 2015 with PCOS and I started gaining weight, having high blood sugar and then high cholesterol after I gave birth. And then when I started using PPAR, the migraine episodes, hypoglycemia, and my drastic gaining of weight stopped. As mentioned, I started to lose weight and look more vibrant. So I trust Simply Nature.
Even before pregnancy, I'm already taking PPARS. My husband and I, we were really taking, I think during the time we've been taking it consistently for 5 to 6 months already, PPARS tablets. So, I even think that helped us during the this pregnancy because based on our experience, we had 2 miscarriages before my 3rd pregnancy and my successful pregnancy. And that time, we've been told that, oh, it's not healthy, that's why you're losing the baby. And then we're just, waiting on the Lord and praying for His timing. And during the time when I got pregnant, I also realized that, oh, actually we've been taking PPARS. So, because I've read and heard that PPARS helps with cell repairs, it strengthens your body, it's high in antioxidants and all that. You know, I really think that that contributed for us to have a healthy pregnancy. And yeah, that's what I also took during that time. After I have given birth, I really had difficulty because I had emergency CS. So, but after, on the third day onwards, I was actually feeling better. After giving birth, we're gifted with PPARS, so praise God, and that has helped me a lot because they said that the hormonal changes do not just happen during pregnancy and even after pregnancy. So we started taking PPARS also. And I know mommies who have given birth, I know you can relate to this. If you have experienced constipation before birth, when you have given birth, it becomes like more. It gets to the next level of constipation. So I'm glad I was able to take, and I was introduced to Cleansing Plus of Simply Nature even before pregnancy. So when I experienced all this constipation, when I took Cleansing Plus, it has helped me with my regular bowel movements and to be able to release easier and faster. When I felt constipated, because it's true, even after you have given birth, if you're already constipated, it's like it's gonna go to the next level of constipation. I don't know how it happened, but when I read about it, it's all because of the hormonal changes that happens in our body and our body adjusting and healing. So it's going through a lot. It has helped me because especially if you have given birth, whether that's normal delivery or you had cesarean, you're not really allowed to put pressure when you're about to go. So you're not allowed to push. So the Cleansing Plus really helps, no, for you to be able to release, better and easier. What has helped me in this pregnancy journey and even before that and even after is that I was taking PPARS. My husband and I were taking PPARS tablets. So that has helped me with, of course, the hormonal imbalances. It has helped us to regulate, and it has given us more energy and have healthier bodies. So it has no contraindication, so that would also help you. So you may try on your own and test it for yourself. Hi, I'm Nesta Vicencio, and here's my son, Ethan Kairos. So I had an amazing pregnancy journey and recovery with the help of Simply Nature PPARS. Thank you, Simply Nature. We love you.
Good morning, I'm Mrs. Melinda C. Hispano. Ako po ay na-diagnose ng stage 2B breast cancer and I'm from Muntinlupa City. I'm a public school teacher. Nung nalaman ko po na na-diagnose ako ng breast cancer, syempre may devastated po. And of course, the whole family, parang our world, no, falls apart, no? Sobrang down. There is no symptoms eh. I just felt the lump. Dalawang lump siya sa right breast. And I was not really going for a check-up sa lumps. I was, magpapa-check up ako sa OB-GYN ko. And I was advised to go to the surgeon kaagad. So, after po ng operation, I was asked to go to oncologist. The protocol is to have 8 cycles of chemo and 33 radiation. When I was on the hospital, sa aking bed, browsing through the Facebook, I saw the face of Dr. Jansen. Sabi niya, makakatulong po sa mga chemo patient, yung Simply Nature PPARS. So if you will just try, malaking benefit po sa katulad naming mga cancer patient. I was advised to supplement chemo with PPAR powder saka tablet. So at first I was hesitant kasi very mahal po siya. Pero first chemo ko, taking PPARS, hindi po ako nahirapan. So I was expecting na yung mga nababasa ko, napapanood ko ng mga side effect of chemo. Hindi ko po siya naramdaman. So I was telling my family na parang maganda po yung PPARS sa akin. I finished the whole 8 cycles without any problem. Thanks to my doctor and the Simply PPAR. Kasi po, even my co-teachers, even my family, sabi po sa akin, hindi ka mukhang may sakit. So that must be a blessing from up high there, no? That I was able to meet Dr. Jansen and I was able to take Simply Nature PPAR. Latest result of my laboratory, all are normal. Yes, thank you, Lord. Continuous pa rin po yung tablet. So I just ordered 6 ngayong May. So that would last for ilang months. My latest ultrasound, fixed pa din po siya. No calcification or anything. So I thank God for that. Mapapayo ko po sa mga pasyente po na katulad ko, go to the right doctor, no? You pray for the right doctor. Kasi ako pinray ko lang para bigyan kayo ng the right supplements. And para yung journey nyo, yung cancer journey nyo, will be very successful. Kaya nga sabi ko, during my PPAR journey, sabi ko sa sarili ko na I will be the most successful chemo patient in the whole wide world. Thanks, PPAR. I will highly recommend po Simply Nature PPAR kasi based on my own experience, it helps me a lot talaga. And it's a blessing to me na take ko yung PPARS. Kaya nga ang sabi ko, I will be the most successful chemo patient kasi may supplement ako galing sa Simply Nature, which is PPAR powder and PPAR tablet. So, blend together, it helps me a lot. And I'd like to thank my daughter, si Cadiz, and also my husband for taking care of me. Hindi siya nagsisisi on that part. Thankful po siya. Kaya nga, nung sabi ko, a-attend kami, and he was very supportive, binatid niya ako dito. I am Melinda C. Spano. I'm a public school teacher. I was diagnosed with stage 2B breast cancer. Upon knowing my situation, it was really a very devastating event. I was advised to do 8 cycles of chemotherapy and natatakot ako dun sa chemotherapy. But with the help of Simply Nature, na-surpass ko, nakatulong po sa akin. It's a big help. Lahat po ng side effects ng chemo, hindi ko po naramdaman. So I'm very, very thankful to Simply Nature because it really helps me a lot. And ang feeling ko, I'm a very successful chemo patient because of Simply Nature. I trust Simply Nature.
Good evening, everyone. I'm Sheila, and welcome to another episode of Simply Healed webinar. This program is proudly brought to you through the collaborative efforts of Simply Nature International and Simply Healed Medical Group, united by a shared mission to support healing through education and science-guided care. As an international leader in wellness, Simply Nature specializes in high-quality supplements sourced from a unique strain of microalgae known as PPARS. This research-backed nutritional approach is widely recognized for its ability to support cancer patients, boost immune function, and improve metabolic health. It is particularly effective for those looking to naturally manage blood sugar, blood pressure, and cholesterol levels. Tonight, we are diving into a topic that so many of you have been asking for. In fact, this has been one of the most commonly asked topics by our viewers. It's a conversation many men find themselves in, being told to keep an eye on their prostate as they grow older without much guidance on how to actually help it. But here's the real question. Why does prostate start growing in the first place? Is it just an inevitable part of aging, or is the environment inside your body sending the wrong signals? Tonight, we're looking past the PSA blood test. We aren't just watching a number. We're looking at how to create an internal environment where your prostate doesn't feel the need to keep expanding. It's not about fear, it's about balance. The prostate is like a sponge for the signals circulating in your blood. When those signals are loud and chaotic, the prostate reacts by growing. It isn't just about testosterone. There are three main volume knobs that turn up growth signals. First is high insulin. When blood sugar stays high, insulin acts like fertilizer for prostate cells. Second is chronic inflammation. Think of this as like a friction in the body. The more friction, the more prostate gets irritated and swollen. And lastly, the hormonal shift. As we age, the balance between estrogen and testosterone shifts, which can trigger growth alarms in the prostate. This is where PPAR pathways comes in. Think of PPARs as the project managers of your cells. Their job is to first lower the heat. They help turn down the inflammation that causes swelling. Second is clean up the fuel. They help your body use sugar and fat more efficiently so they don't turn into growth signals. And lastly, restore order. They tell cells to focus on repair rather than expansion. The goal isn't to fight your prostate. The goal is to change the environment it lives in so that the growth is no longer the default setting. Prostate health is about more than just a lab result once a year. It's about the soil you are providing for your cells to grow in. When your metabolism is stable and your inflammation is low, your prostate gets the signal that it's okay to stay small and quiet. If you have questions about this diet or stress or this cellular managers, help keep things in check. So please type in the comment section. We are welcoming now all your questions. Now, the intention of this webinar is, of course, to make sure that we answer more questions coming from all of you for us to be able to empower you even more in your journey. So without further ado, let's dive right in. Leading tonight's AMA or Ask Me Anything portion are, of course, our highly respected experts. First up, it's a pleasure to introduce Dr. Jansen Kalalan, an alumnus of St. Luke's College of Medicine, and he is a distinguished diplomat of both the International Board of Lifestyle Medicine and Philippine College of Lifestyle Medicine. He currently serves as a consultant specializing in integrative oncology across several premier institutions, including Alta Integrative Medicine and Wellness Complex, Perpetual Health Medical Center Las Piñas, Tree of Life Wellness Center, Central Holistico, and Simply Healed Medical Group. He will be joined by our Singapore-based PPARS expert as a visionary CEO. Behind Simply Nature International, he combines his entrepreneurial success with years of international speaking experience to share deep insights on how health serves as the foundation for true success. Let's all welcome Mr. Shyan Lim. Hello, Sir Shyan. Good evening, Dr. Jansen.
Good evening, Doc. Good evening, Sheila.
Evening.
Happy New Year over already, Doc.
Yeah.
I put on 2 kilograms. Oh my goodness,
Wow.
terrible. Yeah. Doc, before we start, I have a question for you because I met up with a friend and she was sharing with me the condition of her father. So this is a question about diabetes. Doc, the mother, this is the mother. The mother is height is about 1.4 centimeters. She weighs about 47 kilograms. So she is shorter than my wife, but heavier than my wife. About the same weight as my wife, to give you an idea. And she is losing weight. She's 85 years old. Her blood sugar is 8.6. Previous month, it was 8.8. The funny thing is that she's not eating a lot. So, and she's not eating unhealthily. Um, so why is her blood sugar, why is she apparently borderline or mildly diabetic when she's not eating sugar, no carbohydrates? I asked if her diet was fatty. The answer was no, she's just not eating a lot. Yeah.
Yeah. How is her physical activity?
Uh,
Someone doing exercise a lot, or
No,
is
no, just normal walking, walking around 85-year-old, not really exercising at all. Yeah.
yeah, she's thin, right?
Yeah. She is not, yeah, she is thinning. Not as thin as my wife, but yeah, thin.
Yeah. Yeah, that's the reason. Because of the muscle. For elderly,
Mm,
that's always a concern, sarcopenia. So that's the medical term of muscle wasting. The muscle mass keeps going down. Yeah, so
okay.
if the muscle mass goes down, then the organ
Mm,
that utilizes sugar
mm.
is the demand would be the utilization would be less and less because there's less mass. And if it keeps going down, then there would be less muscle cells that would be utilizing the sugar. So this is going to be true even if the patient is not eating that much.
Oh,
Yeah. So muscle mass. So she has to do resistance exercises, build up her muscles so that there would be more muscles to use the sugar.
oh, okay. So
Mm.
here, so another of course. So I told her because it's mild diabetes.
Mm.
Um, it's not it's high, but not alarmingly high. So she's gonna go on the tablets. So
Mm.
on top of the tablets, we are gonna encourage her to eat. And should she eat protein or vegetables or just a balanced diet? Any special attention? And of course, like what you said, do some resistance training, right? Yeah, maybe get a
Mm.
half kilogram kind of weights and let her just play around with it.
Yeah.
What else? What other advice can you give?
Nutrition wise, as long as she eats
As long as she eats.
yeah, as
Because
long as
right now
she
she's actually avoiding to eat because of the blood sugar. She's
yeah,
actually
that
afraid.
that's counterintuitive.
Okay.
She should just eat healthy food, real food. Eat real food. So there should be protein in there. So
Okay. Protein,
could be
vegetable,
plant-based.
carbo.
Yeah. That can be plant-based proteins or animal-based
Yeah.
proteins.
I mean, at
Or
85,
wine.
whatever she prefers, right?
Yeah, and make sure there's enough caloric intake as well, so
Okay.
she can gain weight and not to
Okay.
lose weight further. So
Okay.
that's one. Another one is
Mm.
to do resistance exercises. This is the most important one.
Okay.
Resistance exercises would include weightlifting, calisthenics, your I forgot the term. Pilates,
Mm.
that's also something that she can explore. Now for an elderly 85-year-old lady,
Yeah.
she should be careful of the falls, no? So my advice is she should consult a rehabilitation medicine doctor first or a sports medicine physician.
Okay.
Allow the doctor to create an exercise program for her, then
Okay.
have a physical therapist execute the exercise for her until she can perform them independently.
Oh,
Or
that
yeah,
sounds like a plan. Yeah.
yeah. Then yeah, I think that's the most basic one. So as long as she's able to hit this too, I think there shouldn't be any problem.
Wow. Okay. Thank you, Doc, because this is it was so puzzling, and I'm sure to our viewers as well. How can a person that's not eating carbs and cakes actually end up with high blood sugar? And they're watching themselves, they're eating less and less, and yet their blood sugar is going high. So, wow, thank you. I learned something today, Doc. Yeah. Sheila, back to you.
Well, we're off to a good start. And thank you
Mm.
so much, Dr. Jansen and Sir Sean, for that very first question. Now, for our second question, coming from Miss Carol, thrown to us privately. Question is, in my ultrasound, what does anechoic cyst mean?
Okay, this is an ultrasound term, no? So if it's anechoic, so ultrasound uses echoes. So it uses sound waves to characterize the anatomy inside the person's body. So anechoic means the area that was targeted by the ultrasound probe is not reflecting any sound back. That's why it's anechoic. So the root term or the root word in the term anechoic is echo. Okay? So an there means devoid of echo. No echo. So if if there's no echo bouncing back, no, usually that happens if the area consists of water or air. Okay? So for a cyst, that is consistent. No, actually it's redundant. Well, a cyst contains water inside or fluid inside. So that's why the cyst won't be bouncing any sound waves back to the probe. So in an ultrasound, that will appear as a circular black. So yeah, it's a black circle. That's what's gonna appear in an ultrasound machine. So that's what anechoic cysts mean.
Wow, interesting. Again, we learned something today.
Thank you. Thank you, Dr. Jansen. Okay. For our next question, coming from Miss Lynn. For endometrioid carcinoma with villogranular features, which is better, 30 tablets a day or 1 capsule a day? That's what I can only afford.
Okay, so the limiting factor here is finances. If the goal is curative, meaning you would want the cancer to go away or to disappear, then your protocol has to be combined with your standard treatments like chemotherapy, radiation therapy, and surgery perhaps, no? In order to resolve the cancer. That is curative intent. So the role of PPARS now here would be supportive. Yeah, so this is the recommendation there. Now, which will I choose for the cancer? Tablets or the capsule? I would choose the capsule.
Capsule.
I would choose the capsule even if it's just one.
Yeah.
For the simple reason that the capsule contains the extract of the tablets. So in terms of absorption, you would absorb the contents of the capsule better. Yeah, that's the most simpler the most the reason, the main reason why I will choose the capsule.
Yeah, Doc Johnson gave a complete and perfect answer. So please take his advice and if you need help, ask questions. Our CSO will help you reach something that will work for you. And if you need to and want to, also you can always arrange a consult with Dr. Johnson to find out more. Again, to everybody, do remember, even when you ask specific questions like what you did, this is not a consultation, everyone. All right, this is not a consultation. There are too many things that we do not know about your condition, and you may be leaving out important things because you want certain you may have already decided what you want to do. All right, so then why are we answering? So that you have a better idea, that you can ask more questions that will help you make a decision and better understand your doctor when you go for consult. All right, so if you don't know any doctor that or you like and trust Dr. Johnson, then please arrange for a consult with him. If Sheila, how would anyone get a consult with Dr. Johnson?
Very simple. You can just simply type in how to consult on our comment section, because our caring HCS, Miss Beth and Miss Irish, will definitely get in touch with you immediately. There you go. Thank you, Dr. Johnson, for answering this question, because it's quite a common question that some of our patients, when they started off with liquid and powder, the question is, can they downgrade to tablets right away? But you've answered it today that it would be good to between the
stay
capsule
on.
and on
Because
capsule.
cancer is serious. The tablets are just nutritional support. Yeah.
Yes. Thank you. Thank you, sir. Thank you, Dr. Jansen. All right. For our next question, coming from Domingo, can vasectomy affect prostate enlargement?
Vasectomy and prostate enlargement. No. Reason is when you do a vasectomy, that's essentially cutting off the vas deferens, which is the main tube or conduit that connects your testis to the urethra. Okay? So this is where your sperm from the testis swims up, no? Swims up so that it can go to the urethra. and be expelled during ejaculation. So that connection, if it's cut off, then your sperm will just remain inside your testis. Yeah. It will just remain inside your testis. So now, question is, if the sperm remains inside the testis, will it accumulate and increase in volume and cause your prostate to enlarge? No, because the organs are very, very far away. They're not connected at all. And old sperm, which dies of old age, no, inside your testis, will just be reabsorbed by your body. So it won't affect your prostate size in any way.
Okay. The last time that I've heard of this, vast difference was when I was just grade 5. It's good to be reminded, refreshed with the reproductive system. Thank you.
All right. Okay.
All right. Would you like to add anything, Sir Sean?
No. Yeah, I think we're comfortable with this. All right.
Okay. Thank you, Dr. Jansen. All right. Next question coming from Miss Virgie. Can PPARS help with acute myeloid leukemia, AML?
Yep. In
Yeah.
various ways. It just depends on what the present state of the patient is with the diagnosis. Yeah. So it can come in as a chemotherapy support to help to help you recover faster in between the chemo. It can also help lower inflammation so that you don't waste out, you don't go into cachexia, which is a cancer patient's state of hypermetabolism, consuming a lot of fuel, and so the patient decreases in weight and thins out. Okay, so that's how PPARS in its simplest term on how it can help acute myeloid leukemia. Yeah, so it's basically supportive. Mhm.
I understand with leukemia, AML or ALL, there's different phases in terms of their treatment. Would
Mm.
you still highly recommend for them to be on vials all the way, or do they have other options just for budget concerns that we can recommend to them?
Oh, well, the best would be the vials, the
Yeah.
liquid all the way. You take it until you finish the entire course of the chemo.
Yeah.
But if the patient, for number one, if the patient cannot swallow well, so no. If the patient has financial constraints, for
Yeah, I
example,
think that's
I would still stick with the extracts. So it can be the powder, it can be the it can be the capsules or the soft gel. Now, the only time that I will not advise the powder is when the patient has mouth sores, because that's gonna be painful for the patient to put the PPARS powder sublingually. So I would, if the patient has mouth sores or difficulty swallowing, then I would choose either the liquid or the capsule. One of those. But the dosing would be high, still high.
Yeah.
Thank you, Doc. Sir Sean?
No, exactly what Doc said. I mean, the only thing that would cause, like, if my family member or myself, if we're battling cancer, the only thing that will make me downgrade from a liquid to another extract is financial. But again, it doesn't mean that if you don't take the liquid, then it's not going to be effective, right? Every person is an individual. It's just like saying that if you take the liquid, there is you have the highest statistical chance. You never know whether your body needs liquid level or the powder level, but if you do the liquid level, you will cover all bases. That means you're using the strongest already. So there's no doubt, there is no possibility that you're not doing the best. Okay. But it doesn't mean that you need the best in order to recover from cancer. I just want to be very encouraging. I've heard of cases that actually recover from cancer totally naturally. I mean, really just eating raw vegetables, having a right mindset, really relaxing. I mean, there are even cases where people have recovered without taking any medication or even any supplements. So again, that's such an extreme, isolated case, right? What are the chances that you are that person? It's pretty low. But then again, everybody is an individual, so no matter what you can, whether you are financially limited or not, it doesn't mean that you don't have a good shot or a shot at successfully beating your cancer. So don't be overly concerned. What you should do is speak to our CSO or have an appointment with Dr. Jansen to find the best protocol that you can take, which is sustainable, allowing you to finish the entire protocol and beat cancer. Yeah.
Yes, thank you, sir. I do agree. I mean, our viewers could attest that with the webinars that we've been having for many years, one of the things that they've learned from Dr. Johnson, of course, Sir Shyan Lim, is um, the multifactorial consideration of treatment during the journey. So yeah, so yes, for those of you who wish to have a consult with Dr. Johnson, simply type in "how to consult" or "Caring HCS" will message you right away. All right, for our next question coming from Mr. Luis. Question is how to differentiate if waking up at night to urinate is diabetes problem or prostate problem. Very good question.
Hey, you have to test. That's where the labs comes in.
So, Doc, that means it's possible that it could be a diabetes issue if you wake up at night to urinate.
Yeah.
Oh,
But
wow.
here's a difference, no? Here's the
Okay.
difference. For diabetes,
Mm,
even during daytime, you keep on urinating.
mm,
And there is no lower urinary tract symptoms. So lower urinary tract symptoms include dribbling, frequency, um, difficulty in urinating in terms of the arc. The arc is not as high anymore. The
mm.
pressure is not as good anymore as when you were younger. So if you have those lower urinary tract symptoms, then that is more of a prostate problem rather than diabetes. In diabetes, and assuming that the prostate doesn't have any issues, in diabetes, you don't have any of those. It's just that you keep on peeing and you don't experience any lower urinary tract symptoms. So that's the main difference if we're just basing it on history alone, history of the patient alone. Okay? But ultimately, just to answer the question, how to differentiate if waking up at night to urinate is a diabetes problem or a prostate problem,
Uh-huh.
then you have to undergo labs. So check your
Okay.
sugar, blood sugar, check the sugar in your urine, check a prostate ultrasound if the prostate is enlarged. Okay? But without doing any labs, just by asking the presence of lower urinary tract symptoms, then I would be able to differentiate if it's diabetes or prostate problem. Okay? Yeah, or it can also be a urinary bladder problem, no? There are certain urinary bladder masses or urinary bladder cancer that can produce lower urinary tract symptoms, much like what you experience with an enlarged prostate.
Doc,
Okay?
I just want to say something, when you say that with a few questions you can help to differentiate. I miss having a doctor say this. I just wanted to say, it's so common right now, doctors just say, go and do your lab test, do a blood test, go and do a scan. It's as if it's very nice to hear a doctor use his doctor skills. So I just want to say that. I just want to say that.
Yes. Well, I've also seen how Dr. Johnson does his consults. He's very meticulous. Even he digs deeper to the medications the patients are taking. So do schedule a consultation with Dr. Johnson. Okay, for our next question coming from Mr. Raymond. Question is prostate enlargement something men must accept as they age, or are there strategies to help slow or stabilize?
Well, not really. Not all
Mm,
men, as they age, no, not all men have an enlarged prostate. So, One strategy that you have to implement as early as now, no, even when you are in your 20s or 30s, is to eat right, exercise, make sure there's no insulin resistance present in your body. So that means you're not obese, you're not overweight or obese. You eat right food in moderation. You avoid vices like smoking and the alcoholic beverage drinking. So with those strategies, you'd be able to prevent an enlarged prostate. Because the enlargement of prostate largely comes from insulin resistance. Yeah. So if you implement this, yeah, you'd go a long way with a
Wow,
small prostate.
yeah, very simple. Very simple solution, right? And not only that, if you are eating right, you look good and you'll be strong and energetic, and you will enjoy your senior years, right? Yeah.
Doc, having what you said just right now about insulin resistance, there are a lot of men out there who are quite stubborn to take maintenance medication, as if they always say that it can be resolved with natural solution. What can you say about
Just wait for them to get the scare of a health scare, then they'll change. Because because come on, let's be realistic here. If someone just refuses to be health and just refuses health advice, nobody can convince that person to listen and do
Yeah,
otherwise.
yeah.
Nobody. You'll just strain your relationship with that person.
Yeah.
So don't don't keep on nagging someone about it. Eventually that person will change. Eventually that person will change. The person already knows the risks. The person just doesn't want to, either the person is in denial, or the
Yeah.
person is really not motivated enough yet
it?
to do the necessary changes, or the person is thinking of on how he or she can probably implement the necessary lifestyle changes that works for him, that works for the person. So the person knows. So just wait and wait and wait. Don't keep on nagging, and eventually the person will do the necessary changes to have to take the medications, etc. Yeah, so I'm not someone who I will so I am a doctor. When you come to me, I will only tell you once that what you're doing is risky. Then that's
Yeah.
it. That's it. If
Oh,
Yeah, that's it. I won't keep on repeating the things that that that's already, come on, you already have those problems. You only need one doctor to say it, not multiple times. Come on, I mean, you're gonna doctor hop. I mean, the advice is gonna be pretty the same unless you have that much money to go on doctor hopping, and you're paying for advice that you can even get from Google. Come on, I mean,
OMG, Doc, I was with my Chinese physician today, and we were having exactly the same conversation. She said that my wife was asking about what to do with patients that are stubborn. Then the doctor said exactly what you said. Don't worry, they'll change. It just needs to hit them, right? The only disease that you really don't want yourself to be hit is like diseases like cancer. It's just so difficult, right? But you're right about metabolic syndrome, and I think the reason why people will be stubborn about things like diabetes maintenance drugs is because they also know at the back of their mind that they can turn around when things get serious, right? It's very different from cancer. It's very different from cancer. So, doc, yeah, it's just the is and this is even true for Dr. Jansen himself.
yeah,
You look at him, he's so handsome now. But there was a point he suddenly put on a lot of weight.
a lot of weight, yeah.
A lot of weight. I said it to him, I think only once or twice. I didn't nag him. And then at some point he realized, and now he's back to his handsome self. So
Yeah, that's true. That's true. I mean, it's also true for me. I mean, my wife kept on nagging me, "Hey, you're too fat. Come on, you have to lose weight." So yeah, I mean, it took me a year before I was able to do the necessary changes
But
that I'm
once you
doing
did,
right
it was
now.
so fast. You were like in 3 weeks, you were back to your Tom Cruise look already. Yeah. Yeah. So I mean, I think what's interesting is, and those of you who are watching this program, we hope to give you the information, and maybe it's the tipping point enough to push you. If it's not enough to push you, maybe at least we make sure we planted the seeds that when you decide to get well, you know what to do, and that you can. All right. So, but I guess the best thing is trying to make the right choices. Although I know I'm also guilty of it myself. Yeah.
Just want to say, don't worry, Doc Jansen. I think Doc Grace would agree. We didn't notice that you are guapo all the way. Don't worry.
Yeah, she has no choice.
Yes.
Hi,
Yes.
Doc Grace. All right, for our next question coming from Mr. Antonio. Question is, can BPH become cancerous?
Interesting question.
Mm.
Can be BPH. Okay, BPH is benign prostatic hyperplasia. This is when the prostate
Enlarged.
and it is basically prostate enlargement, no? But this is when the normal prostate tissue just multiplies in number and they're still normal. Now, BPH, I don't think it I don't think it will become cancer later on. BPH itself, as a risk factor for prostate cancer, I don't think it is. But the risk factors for you to develop BPH are risk factors for you to develop prostate cancer. So if you have those risk factors, you can develop prostate cancer without going into BPH first or without having BPH first. So you can have a normal size prostate and yet have prostate cancer. Okay?
Oh.
So BPH per se, I don't think it is a risk factor for prostate cancer, but the risk factors for developing BPH are the same risk factors that you have for developing prostate cancer. Yeah, but the step is for you to develop prostate cancer, you don't have to necessarily go through BPH.
That's why you said it's interesting. Thank you. Thank you, Doc.
Mhm.
Okay. All right. There's a question from our YouTube channel.
All right.
Question by Miss Marmina Andrada. Good evening. Is this live?
Yes, it's
Oh
live.
yes.
It is live.
Yes, you're watching it simultaneously with our Facebook page. I just want to say hello and good evening to Miss Noemi Veras. Good evening po, and thank you for watching our webinar tonight. Okay, for our next question coming from Miss Olivia. Question is, why do certain cancers spread to specific organs? For example, breast cancer to bone.
Interesting question again.
Interesting question. I think this is the first time anyone asked this question in 5 years.
Yeah.
Yeah.
And good observation, Olivia. Very good observation. There are a lot of cancers in our body. And when these cancers metastasize, they metastasize to specific parts of the body only. Yeah. They metastasize to, well, in theory, they can metastasize anywhere. They can spread anywhere. But they have a propensity to go to certain parts of the body. Okay. The reason for this is there are molecular, or I should say receptors, no, or yeah, receptors along the cancers in the cancer cells that fits more. So it's like a lock and key. So you have keys present along the cancer cells that fits the keyhole of certain organs.
Mm.
So for breast cancer, it really fits. Breast cancer metastasize more commonly to the brain,
Wow.
bone, lung, and liver. This four.
Mm.
For prostate, it's bone. The bone, the colon, and the lung. So these three. For I'll give another example. For lung cancer. For lung cancer, it usually goes to the liver. Not for the bone to some extent, but not as common. But
Oh,
it really
wow.
goes to the liver more commonly. For colorectal cancer, liver, lung. These are the two. Bone, not so much. Yeah. So
Wow.
you have these tendencies. Yeah, which is really interesting. And up until now, nowadays, we
Mm.
are still finding out why these certain cancers tend to metastasize to certain parts of the body only and not to others.
Mm. Wow.
Now, here's another example, a very
Yeah.
interesting one. Brain cancer,
Yes.
brain cancer
Yeah.
doesn't metastasize distally.
Oh.
It only remains in your head.
Oh, wow. Is that because of the BBM?
Yes, that's because of the actually
Blood.
the blood-brain barrier. That's
Yeah.
one of the main reasons.
Mm.
And another reason is the brain is wrapped in the dura inside the dura mater. The dura mater is a thick layer. It's a very not really a thick layer, but it's a very tough layer surrounding the brain.
Mm.
So this is also something that keeps the keeps any cancers growing inside the brain to remain inside.
Mm.
And brain cancer is also a very aggressive cancer, which can be also one reason why we don't tend to see this to metastasize elsewhere distally. No, for example, to the lung, to the liver, because it's such an aggressive cancer that the patient can pass
Okay.
away first
Yeah,
before
you don't need to eat to even metastasize.
yeah, for it to metastasize. So these are certain tendencies. Yeah.
No, I guess I'm gonna ask a very old question, when we get when the patient gets a prognosis or diagnosis for cancer, that's straight away they are afraid of for their life. They could die, So uh medically speaking or mechanically speaking or biologically speaking, how does cancer actually kill a patient? Yeah.
In various ways. No, number one, since we're talking about metastasis, so that's one metastasis when it metastasizes to areas of the body that is vital for life. So I'll give you an example.
Mm.
Cancer grows big, metastasizes somewhere near your esophagus,
Mm.
or yeah, so it enlarges there. You can eat.
You
Because
can't
you
eat.
can eat, you die of malnutrition. That's one.
Okay.
Another one is when the cancer metastasizes to a part of your brain that controls functions essential for life. Say, for example, it metastasizes to your brain stem, then that's a
Oh,
death
that's it.
sentence.
Mm.
Okay? Because the brain stem controls your breathing, it controls your heartbeat.
Mm.
Yeah, so those that's just one, no? Another one would be if the cancer bleeds. It's if the tumor is bleeding, they can die of blood loss. Another one would be
Oh,
the state of the patient itself, no? Kakek siya. So sometimes cancer patients go into a hypermetabolic state wherein the patient's body is utilizing glucose, proteins, and the fats very,
so
very fast. So you're growing thinner and thinner and thinner. And because your weight is going down and inflammation is too high, then yeah, this
your
state,
body just breaks down
yeah,
and
the body
fails.
just breaks down and you will die of this condition.
Wow.
Another one would be if the cancer metastasizes, say, for example, to the lung,
Mm.
it forms fluids or it metastasizes to your abdominal cavity.
Mm.
Um, it causes fluid to accumulate, then you can die of the fluid accumulation. So various ways, no? These are the more common ones why a patient can die from cancer.
Wow. So, you know what? To the viewers, why did I ask this question? Because when you understand how cancer kills you, then you will also understand why the doctor or Dr. Jansen would prescribe you and advise you certain protocols, right? Why is controlling inflammation important? Because if you're losing weight and your body's shrinking and you're inflamed, that's what causes you to die, right? So if you can manage the inflammation, then you're keeping, you're minimize. Okay, you're managing the way the cancer is trying to is killing you. So then this gives you better understanding on especially for integrative medicine, right, is also supporting the rest of the body's functioning, working together with chemotherapy and immunotherapy. So the chemotherapy is attacking the cancer. Dr. Johnson might be doing something to help you manage your inflammation so that the cancer does not damage your body that much and you're able to recover and you can fight longer, right? So that was the reason why I asked this question. And I hope that was interesting and helps you.
It's it should be an eye opener. While I was listening to Doc Johnson earlier, it should have created a sense of urgency, most especially for those who are in the early stages. So I
Yeah, and it also
think
makes you realize, if you're experiencing, you're losing weight and you're feeling very warm because you're inflamed, that you are in danger and that there's a sense of urgency, right? And you need to do certain things, something about it. Yeah.
yes. Thank you, sir. Thank you, Dr. Johnson. Right, for our next question coming from Miss Andrea, question is, can PPARS help with amoebiasis?
Amoeba is an infection. No, you need antibiotics. Antibiotics is way, way cheaper than PPARS. So go for the antibiotics.
Yeah.
Yeah,
Doc,
yeah.
Doc, I want to ask you about
Fantastic.
antibiotics. There's such a big deal, especially even in the medical community, about the ethical I think maybe ethical is the right word, ethical use of antibiotics so that it will continue to be effective for all humankind in the years to come. So what are some of the guidelines when you are being prescribed antibiotics, and what are some of the concerns? Why are doctors concerned about antibiotics abuse? Yeah.
Yeah. So one reason is you take antibiotics when you don't need it. So one would be you have a viral infection. Take antibiotics for the viral infection. So that's wrong. Okay.
Oh, okay.
Antibiotics will not work for the viral infection. It will
Okay.
not even shorten the
Life
time
cycle.
that you are sick. Okay.
Yeah.
So that can increase antibiotic resistance. Another thing is when you don't complete your antibiotic course. So say for example, you have a bacterial infection, you took antibiotics and you don't finish the entire course that the doctor prescribed. So say for example, you only took it 2 days when you were prescribed for 7 days. So that can also promote antibiotic resistance because the bacteria are living. It's a living thing. It adapts. So when you apply stress to them, the evolutionary mechanisms of the bacteria will kick in, and they will try to survive, and um they will try to survive the high stress environment that you just place them in, which is the antibiotics that you took. Okay, so they will try to live and survive. So you have to keep on pressing and pressing and pressing, so they die or they decrease in enough number so that your immune system can take over and kill them. Okay, so that's what antibiotics are for. And these are I think the most important reasons why we develop antibiotic resistance in the first place. Yeah, so you don't complete them when you were prescribed one, and wrong use of antibiotics. You're taking it
Wow.
for a fungal infection or a viral infection rather than a bacterial one. Now for amoebiasis, amoeba is actually technically not a bacteria. An amoeba is a protozoan. So it's a single cell organism wherein we use metronidazole to kill them. So metronidazole in this case would be classified under an antibiotic. Yeah.
It's always amazing when I hear Dr. Johnson talk and when I hear doctors talk, because you guys seem to have an entire encyclopedia in your mind. I mean, you remember all the, it's obvious that you don't deal with bacteria on a daily basis. You deal with like cancer patients, but yet you still remember these names. I'm wondering how stressed you were in medical schools that you can never forget all these terms. Yeah, but it's really amazing. Yeah.
Yes, thank you, sir. In Tagalog, sir, ang galing.
Well, just to let you know,
Yeah.
we don't remember everything, every single one that we studied in med school. So probably right now, when I graduated, probably I was using around 60% of the things that I learned in med school. 60% when I freshly graduated.
Uh-huh.
When right now, I am probably utilizing just 40 or 30 or 40% of the things that I learned in med
Oh,
school.
so it's dropping.
It's dropping, yeah, because I'm taking care of,
Specializing.
I am
Yeah.
specializing. Yeah, but just to let you know, the
Yes.
protocols that I use right now,
Mm.
they are probably around 10% only I use still from the things that I learned in med school. Around 10%. Everything now is kind of new.
Wow, I think that's very encouraging because especially in conventional Western medicine, there's always new understanding. So it's very encouraging to know that your doctor is using a lot of new understanding as well. Yeah. So that's why, Doc, right? We have confessed on this program before that our recommendations today have some
Right.
areas have changed
Yes.
from 4 to 5 years ago. That's not to say that we did not know what we were talking about, but to give you an example, right? When when your knowledge deepens, what was what was necessary in the past is no longer necessary today because there's another way of doing it. So that's why things change, right? That's why things change. And of course, there are some areas that are actually fine tuning, and there are some areas where our understanding has totally flipped. So I'll give you a good example, right? For me, this is for me. This is different from Doc Johnson because Doc Johnson's coming from a doctor. I'm coming from the other side. For me, last time I always thought oncological protocols like chemotherapy is really bad, right? But the moment we found out that PPARS could minimize or help protect you from the side effects of chemotherapy, then suddenly my my rejection of chemotherapy totally reversed, right? Because I understand for some patients who are stage 4 and it's very serious, they need something to act on the cancer tumor straight away. Chemotherapy is really one of a very strong tools available. So this is where our understanding, because there are new developments coming in. Dr. Johnson talked about using ivermectin, right? I remember when it was first come out, everybody was also very skeptical about it. But then when the knowledge of repurposing drugs come in, it has flipped the whole understanding as well. So yeah, so I think this is a good reason why you have to keep listening to our programs because we keep updated and we'll give you the best options available. Yeah.
Thank you. I just want to say we are very proud and thankful that the both of you, Sir Sean and Dr. Jansen, have been in continuous study,
Yeah.
exploring many things for our patients.
I think one thing that I really love about Dr. Johnson and our approach is this: we never assume that we are always absolutely right. That allows us to improve. I think that is very important. The worst thing that you can do is think that you're right and things have changed, and we end up not giving the patients the best advice. So being able to learn new things and admit that things are no longer the same as the past is an important part of being able to give the best to the patients. Yeah.
All for the love of patients. And for those of you who wish to have a consult with Dr. Jansen, okay, to experience how meticulous it is and how very good he does his explaining towards your condition, please type in how to consult. We can schedule you with a consult with him. Okay. All right, for our next question coming from Mr. Derek, question is, my grandma tried PPARS powder for breast cancer. After a few weeks, she observed the 2 cm lump getting smaller, but according to her, it hurts more than before. So is it getting better or worse?
So when a heart cancer lump is more sensitive and hence feel pain, is that a good thing, bad thing, Doc?
Shrinking.
Yeah. I'm thinking the reason why this is so is because the immune system is attacking the cancer. So it's inflamed, no? This is positive because the lump is actually getting smaller.
Yeah.
Yeah. So this is when you need pain medications already. Okay.
Uh,
So yeah, but of course, no, you have to make sure no proper tests are done. So I would for in this case, no, I would request for tumor markers like CA15-3 just to see the trend if it's going down. Perhaps an ultrasound just to see
Yeah.
a comparison to how it was before and the current size. Um, yeah, these things, these are the factors where that I would look further into. But for me, yeah, this is something positive because the lump is actually
Positive.
getting smaller.
Smaller, smaller. And doc,
Mm.
we've also had experience before, right? That when like for example, for breast cancer, if the breast tumor, cancer tumor is fused to the bone and it's hard, right? You can't even operate on it. So there are times when we manage to soften the tumor. It also the tumor is also more tender and more painful. So I think this is exactly this is likely, I won't say exactly, likely the situation of your grandma, right? That she can feel more pain because it's more tender. Why? Because the like what Dr. Justin says, the immune system is attacking the tumor, so it is more tender. So it will hurt. But that's a good thing because the tumor is shrinking. So I just want to congratulate you. What wonderful news at the beginning of the year, right? That things are turning positive for your grandma.
Thank you. The Derek actually has a follow-up question that is also interesting. Question is it possible for breast to explode? I think breast tumor.
Oh, breast tumor.
I guess.
So I think
Explode.
he's thinking that if the tumor is being attacked too much, or in the process of shrinking, is can it rupture? Can it burst? Yeah.
Yeah, because doc, there are some breast cancer that are already wounded, has fresh wounds.
Yes,
Is it
yes.
possible?
This is yeah. It's really very possible. So I have seen a lot of breast cancer patients, tumors, no, which that ruptures,
Mm,
and the inside would be a lot of pus that's coming out.
mm,
So this is when. So
mm,
how does such a thing happen? So you have a tumor. So the tumor gets bigger and bigger, and inside the tumor, usually it lacks blood supply already. So inside the tumor, it will die. So it becomes necrotic. So when it dies, the cells now would become a pus.
mm,
So now the pus would accumulate inside and
mm,
there's no way for it to escape, no?
mm,
Because around it would be the tumor.
mm,
Okay. So there would come a time wherein when it will accumulate, then the tumor grows even further, and then yeah, it will eventually rupture through your skin. This is very, very painful. This is very, very painful. And usually, if I usually I have encountered a lot already. When the time comes that this happens, may for Philippine setting only, okay, for
mm.
patients here in the Philippines, the next advice would be to go for the chemotherapy already because chemotherapy can very quickly dry out this tumor, so it doesn't you don't bleed out and it doesn't become like a boil that's oozing of pus.
Mm.
Yep, so chemotherapy for this case is very much encouraged.
Okay.
Okay, and the sad thing is there are a lot of patients who would still refuse chemo even if they have
Hmm.
such a thing already. If it's now, can you still avoid chemo if 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 the okay, so let me rephrase. Can you not go for chemotherapy if the size of the wound is still small? Yes, it can be removed surgically if the size is still small. I have also encountered one patients wherein we started to see a small wound that's oozing of pus. Then I immediately told the patient to go see Dr. Jimmy.
Oh,
Dr.
wow.
Jimmy
Okay.
Katapia. So Dr. Jimmy in this case remove the breast outright. Remove the breast first, then advise chemo later because the size of the wound is still small. But
Mm,
for patients who have an ulceration that is really big already, then
mm,
surgery might not be recommended immediately because you risk infection. So the wound has to be dried out first before it can be surgically removed.
Doc, follow-up question. The reverse. It makes sense and it's easy to understand that if the tumor keeps growing big, will it rupture? Will it sort of burst, right? Of course, it doesn't burst like a balloon, but it will start to leak. Now, is it possible that when a tumor, so what happens? Is it possible on the reverse, when a tumor shrinks, that can it leak or less
Not
likely?
really, less likely. When a tumor
Okay.
shrinks, less likely that it will leak. Yeah.
Okay. So I think this is good to hear for this particular viewer because your grandma's tumor is shrinking. So you shouldn't be afraid of it shrinking and bursting. So it usually bursts when it grows bigger, not when it's shrinking. All right. So I hope that gives you more peace. All right.
I
And
have
encourage your grandma. Encourage your grandma, right? That things are going well. It's important for her to be positive. Yeah.
I just have a very quick follow-up question, Dr. Jansen.
Okay.
Would you agree that our PPARS vials could help faster or fasten the recovery in terms of wanting it to be dried up alongside treatment?
Yes, yes. So now the treatment for these kinds of cases would either be chemotherapy or surgery. So you can use PPARS there to assist the patient recover from surgery faster or to help the patient recover the cycles in between the chemo faster.
Wow.
So that's where when PPARS is going to come in. Now another factor that we have to look into during this point is inflammatory markers. So if the inflammatory markers are high, if the patient is growing thin, then PPARS would also be very helpful because PPARS has a lot of omega-3 fatty acids, which will
Okay.
really help with lowering the inflammation and making sure that the patient's muscle mass is preserved. Yeah.
Wow. Okay. Fantastic. Wonderful.
Thank you, Dr. Jansen. Thank you, Sir Sean. Okay, for our next question, coming from the person who asked if our webinar is live tonight. Okay.
All right.
Coming from Ms. Marmy, question is, for thyroid nodules, does a needle biopsy still needed or required?
Depends on the TIRADS category. So the TIRADS category will determine the risk of thyroid cancer based on the ultrasound characteristics of the tumor. Now, as your TIRADS category go up, then the cutoff size for nodules to be biopsied would go down. Okay, I'll repeat. If the TIRADS category go up, so this means that the likelihood of the nodule of becoming cancer is higher. Again, the higher the TIRADS category, the higher the likelihood that the nodule is cancer. Likelihood, okay? So if the likelihood of a nodule being cancer is high, then the more urgent that we have to confirm that it is cancer. So the cutoff value of the size would now be smaller.
Okay.
Okay, so if this thyroid nodule is categorized as 4 or 5, then the answer is yes. Okay, but if the TIRADS category of this nodule is 1, then you just have to observe. Okay. Yeah, so this is generalizing things. Ultimately, you have to look into the TIRADS category and what the cut-off sizes of nodules so that it will trigger fine needle aspiration biopsy.
All right. Thank you. So you see, we learn again, right? So actually it's based on the danger, right? So the seriousness of the case, right? Yeah.
Thank you, Doc. We're learning so much tonight. Thank you.
Wow.
Okay, I think this would be
Last
our
question.
last question for tonight. Coming from Mr. Hermoso Morsupas. Question is, do you have medicine for kidney high creatinine or supplements for high creatinine?
Oh, yes. High creatinine, you can try soft gel capsules. Of course, whatever other medications as well. But as a natural supplement, this is one thing that you can definitely try.
Yes. Dr. Jansen, would you like to add anything?
Yeah, I think Sir Sean already answered for high creatinine.
Yeah.
But I will add, if a patient comes to me with CKD, then I would add Cleansing Plus. Because Cleansing Plus also acts as a binder for the potassium and the phosphorus.
Mm.
Okay.
Mm.
All right. Sorry, there's one pahabol question. Last promise. Something like that. Okay. Question is, do I have to have an assessment before deciding to take PPARS, and is PPARS for a long time therapy?
Wow, this is an interesting question. Do you need an assessment? Okay, you don't need a assessment to start straight away because you don't delay, right? Don't delay. If you have a medical need and you need don't delay. But you can continue to have assessments to see how you're progressing as you take the PPARs. All right. Now you can also choose to have an assessment before you start so that you are really clear about it. So again, it depends on your illness, right? If you have diabetes, you don't need an assessment to start eating PPAR tablets, all right? And you can't overdose on our products, so don't worry about that. But if you have cancer, you might want to know the proper dosage, the type of extracts, what else can you do? So you might want to need an assessment of your condition before you start. So it really depends on your illness. For those illnesses that are not, how shall we say, critical and worrisome, then having an assessment is something option based on your comfort level, based on your understanding. But if you have a critical illness, it's good to have an assessment.
Thank you, Sir Sean. Thank you, Dr. Jansen. Okay. All right. Well, it looks like we've covered all our questions tonight. Yay! And I just say I'm so happy to have you both back. The past webinars,
Yeah, sometimes it's me, sometimes it's Doc
Yeah.
Johnson, and
Right.
sometimes it's not both of us. It's them alone.
And so I am very happy to have you back, both back tonight. Now, of course, just before we end the webinar, as we wrap up this evening, we'd love to hear your final thoughts for our viewers.
Okay, I'll go first. So I just want to thank everyone for attending tonight's webinar, and please continue to do so to support our program so we can help more people. No? For those of you who are interested in consulting and is wondering what I'm doing, basically what I do, I practice integrative oncology, and the patients that I see are patients who are looking for support in their treatment from their medical oncologist. So this will include chemotherapy, radiation therapy, targeted therapy, immunotherapy. So if you are someone who's looking for support for these treatments that you are going through with your onco, then yeah, I'm your guy. And for those of you who are, kind of, okay, these treatments are not applicable to me anymore. It's either my onco told me that we cannot, we cannot do any more treatment. Like for example, chemo, we cannot do it to you anymore. Then that's where also I come in. Or if you are someone who just refuses to go for these treatments, the treatments that I have mentioned, then I'm also your guy. Okay, so yeah, feel free to message Simply Nature's team to reach out so you can have an appointment with me. So that's it for me. Thank you everyone for listening. And I'll give the floor to Sir Shan. Good night.
Good night,
Thank
Doc.
you.
I think today's program is very lively. It means that Doc Johnson is quite energetic today. He's not as tired, and same here for me as well. So we really enjoyed our time in answering the questions today. So please join us again next week. And also for you to let you know, if you enjoyed our conversation today, we are even more lively and more interactive in our live program. So we actually have 2 live programs every year. It's called our SMX Aura Live. I think this year first one is it in May or April?
May 30th.
May 30th. So those of you who want to be with us live, we'll both be on stage at the same time. And there'll be an open panel like this where you can ask questions, and we will be interacting not only with each other, but also with you, because you will be there live. So with that, I'll return the floor back to Sheila, and see you everyone next week. Have a good week ahead.
Thank you, Sir Sean. Okay, well, thank you so much, everyone, for your questions. And thank you for considering our program a program of value while you journey with your own health battles. On behalf of our patients and viewers tonight, thank you so much, Dr. Jansen and Sir Shyan Lim, for putting so much effort and care towards our viewers. Now, exclusive, please stay tuned because we have a lot of promos ongoing, of course, for all of you. Now, exclusive for website orders only, you can still buy your PPARS liquid extract or PPARS powder extract with no shipping fees. So whether you are ordering from Metro Manila or anywhere nationwide, you can avail this free shipping promo. And once again, this promo is only available via www.simplynature.asia. Now, before we say goodnight, we just want to inform you that if you buy PPARS liquid extract or PPARS powder extract, you can automatically get free AD Pro serum. So giving you both internal cellular support and external skin nourishment in one powerful promo. So yes, this means if you buy your extract or your liquid or powder extract via website, not only that you are getting the free AD Pro serum promo, you are also getting or availing the free shipping promo. There you go. How exciting, right? Now, on a tight budget, that's okay, because if you buy the tri-pack or 3 blisters of PPAR soft gel capsules, you are getting free Renew mask. Wow. Now, these promos, once again, are available via direct order here in our BTC office or via website. Once again, that's www.simplynature.asia. Now, if you've been dealing with stubborn eczema, psoriasis, acne, or even recurring skin irritations, and nothing seems to work long-term, it's time to level up your skin game. Introducing AD Pro Probiotic Serum, designed to support your skin barrier, calm irritation, and help rebalance stressed-out skin. Whether it's breakups, flare-ups, or rough patches, this is built for real results. Especially for those of you who are doing radiation, this is also perfect for you. Now, here's the best part. You can actually buy one, get one today. Please reach out to your assigned client service officers to know how to avail. And because these are, by the way, available via Shopee, Lazmall website, and via direct from office orders. Now, this is limited time or limited time promo only. So please reach out once again to your assigned CSOs. Now, here's the thing, our very much awaited event. If cancer has touched your life, this is your next step. Remission is not the finish line. The real work in building an internal environment that supports long-term stability. Join us for a live in-person seminar featuring a powerhouse panel of cancer experts as we unpack the science of inflammation, metabolism, and sustained recovery, entitled Beyond Remission, Building a Body That Sustains Recovery, happening this May 30th, 2026. That's a Saturday at 8 a.m. to 11 a.m. at SMX SM Aura BGC Taguig. So guys, seats are limited, so please secure your seats now and learn. Please watch out, of course, for our upcoming announcements. There you go. But as early as now, please reach out to our assigned CSOs to know how you can purchase your tickets. Okay. And last but not least, we're expanding our hours to better serve you, because health and recovery don't take a day off. Simply Nature is thrilled to announce that we have started our Saturday operations. Yes, we are now open on Saturdays, whether you need to restock your favorite PPARS or pick up your Cleansing Plus here in the office. We are here to support your wellness. We are welcoming both online and pickup orders from 10 a.m. to 4 p.m. every Saturday. So please reach out to me, Sheila, Miss Jen, or Miss Daisy to coordinate your orders. We look forward to seeing you this Saturday. All right, now we hope to see you next week for another episode of Simply Healed webinar. That's happening for another Thursday, same time, same day at 7:30 as well. So thank you so much for spending your time with us. This is once again Simply Healed webinar powered by Simply Nature International and Simply Healed Medical Group. And remember, your curiosity about your health condition and your victories over cancer and metabolic diseases are what keeps us going. Because here in Simply Nature, we're always with you from start to healing. Thank you, everybody. Good night, and God bless you all.